Today we have a case when a patient came to us with a complaint about pain around tooth number 13. The patient has two upper bridges with different morphology and different colors, but the case itself is the replacement of the canine and the proper extraction, the placement of the implants inside a tooth socket, and then the restoration itself. So in this case, when we have a problem with a tooth and we want to extract the tooth and place an implant inside instead of the tooth, we need to have a proper extraction. Proper extraction means that we extract only the tooth and not the bone that surrounds the tooth. It sounds very logical, but in this case, if you want to place the implant right after the extraction, you need to have as minimally invasive extraction as it can be. So what we do is we extract the tooth in tiny little pieces, so the socket itself won't be harmed and will be as small as possible. You don't want to enlarge the socket when you...
By moving
by moving the tooth, exactly. So we extract the tooth. Instead of this tooth, we place an implant. When you're placing the implant, you want the socket to be as small as possible, and you want to have as big as possible torque that can be for this implant, because the bigger the torque, the bigger the primary stability of the implant. The two other implants were placed distally to the tooth. The bridge had quite a long span. You can see that she had a bridge from the canine to maybe 7 to tooth number 17. So she had 3 unit pontics. In this case, we placed the implants, and because of the aesthetical problem, you don't have any other option than to have immediate loading in here. You can't send the patient home with such aesthetical flaw. Mm-hmm. So on top of the implants, we placed multi-units. And right now what we'll do is we'll take impressions from the multi-unit. Into the multi-units we're attaching scan abutments. You can see that the height of the scan abutment is much bigger than the height of the tooth is going to be, of the crowns. The teeth themselves very small because she's grinding her teeth. You can see the form of the teeth that she grinded and the crowns on the upper jaw. We placed 3 scan abutments. We scanned those 3 scan abutments, and right now we're going to mill the temporary bridge. For the time between the scanning process and the assembly of the bridge, we placed healing caps. And right after the bridge was done, it takes about a day, for example, or maybe 2 days. You have the bridge, you assemble the bridge on top of the multi-units. You can see here the bridge, the teeth themselves, you can see that they're very small. The proportion between the height of the tooth and the width of the tooth is very problematic.
I see you use a large sleeve because you have a small screw channel.
Yeah, we use the regular 4mm sleeve. With the 4mm sleeve we can have a small screw channel. In this case, because the teeth themselves are very small, you want to have the smallest screw channel that can be, because you want the bridge to be as strong as possible. As much more material that can be.
This is the bridge mounted.
Yeah, this is the bridge mounted. You can see that all the upper teeth are very, very, very small. We closed the holes, the screw channels of the teeth, and we made the bridge a little bit smaller because in the upcoming couple of months, it's very problematic for 3 implants to be immediately loaded.
So you took it out of occlusion?
Yeah, we took it out of occlusion. We want as less as possible forces to be applied on those implants, on those bridges. We hope that she'll eat on her left side, not on the right. And we took it out of occlusion also because she's grinding her teeth. When patient grinds his teeth, a lot of forces are applied on his teeth all the time, and most of all at night. So we take it out of occlusion.
And you send her home for like 2-3 months until the healing process?
Yeah, probably 3 months until the osseointegration process is completed. When the osseointegration process is completed, in this case you can see that we'll keep the straight multi-units. Maybe we'll change the height of one of the multi-units. We still probably want to take impressions again because we want to have a healed gingiva with in the impression, so we can form the gingival area of the bridge in the proper way. But I'm not sure we're going to change the multi-units themselves.
Thank you very much for being with us here.
You're welcome.
And thank you for being with us. Don't forget to like, share, subscribe, and follow to stay tuned up to date. Have a great week.